nobody at doing this work, you want to do the same thing year after year after year after 10, 20 years. You want to influence what other stakeholders are doing in the ecosystem. You really want to change the system, right? So you need to see that change. And so that's why advocacy is at the heart, I think, or should be at the heart of every nonprofit, which is otherwise it's just charity. But no, we're saying we want to work it's not enough to demonstrate the need, because the need for any topic that you're talking about is going to be generally vast. And how does your need compare to another group's need? How do you interest somebody that might not already be passionate about your cause just through the need? And I think that you do have to talk about the need. You need to know how to serve. Obviously they're connected in a really fundamental way, right? So there would be no market for what they produce if it were not for people that needed these drugs. And I think that's recognized in a lot of ways. And I've met some really wonderful people that work at various pharma companies on these issues of access, whether it's on the government and policy side or if it's on the foundation side.
Welcome to Global Diabetes Insights, your go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into empowering conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is to not only guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights.
So today we're thrilled to have Rachel with us to join us, a visionary leader in non-profit advocacy and global health partnership. Rachel's work has driven transformative initiatives like 10 Plus, NCDI Poverty Network, all while trying to mobilize so many things, over 200 million. This is what you read, Rachel. In this episode, I think we're going to explore your journey to dive into strategies for sustainable partnerships, which I think every other organization that is doing any type of charity-based organization, they want to have sustainable partnerships, but they have permanent funding. So I think maybe we're going to discuss about that, empowering communities to tackle diabetes work via NCDs. So let's get started. If you could maybe introduce yourself, Rachel.
Of course. Thank you so much, Tino. I am thrilled to be having this conversation with you. As you said, my name is Rachel Gasana. Right now, I am Senior Director of Advancement at the Center for Integration Science at Brigham and Women's Hospital, which is based in Boston. It is a mouthful of a title. In that role, I'm also deeply involved in supporting the NCDI Poverty Network, which is where I met you. And I've been in that role since January. I think this kind of core question of how I got started in this journey and how did I land here today. I start way back. I let everybody know that I grew up in Detroit, Michigan, in the city, which if you're not American, within America, Detroit has a reputation for being a part of the United States, which is full of significant socioeconomic and racial disparities in access to resources. The city itself, when I grew up there 35 years ago, was 90% African American. The suburbs surrounding it, 90% white. All of this had happened over decades of kind of disinvestment in the city. And there were a lot of complex things at play there. But I grew up in the city. I loved it. There was so much richness there, so much to do, beautiful architecture. And then I went to college at Dartmouth in New Hampshire, which is an Ivy League school. It was a complete culture shock because I went from a city that was fantastic, but was struggling to pay for the central resources and provide for the central resources for people that lived there. And then I land on a campus that had everything provided to you. It was incredibly privileged to be there. We were in beautiful dorms, beautiful campus, everything's landscaped, you're fed, all of your needs are attended to and met. And I witnessed firsthand how having all of those things provided for you really gave you the space to engage with what gave you joy in life and engage with ideas and engage with and pursue career and invest in yourself in a way that when you aren't given those things, it drains you, right? And the other thing that I observed was that I met a lot of people who didn't necessarily have the same background that I did, and so weren't necessarily even consciously thinking about the immense level of privilege that they had, kind of wandering the world with this level of support and this sort of safety net, which is fantastic. But that's something that you realize, oh, like not everybody has access to that. But if you've had access to it your whole life, this is normal, this is expected. So what are the expectations that you're bringing to life and what others owe you and what you can do in the world? And if you start off life with a safety net, you're going to have higher expectations. So that contrast is really what spurred me to go into nonprofit leadership. So I wasn't really interested in how do I make money for a large company? I was primarily interested in kind of thinking about and solving in whatever kind of small corner of the world that I could, thinking about these issues of these disparities and how do we progressively bring society so that there's more and more of a safety net and so that we're more and more aware of how to unlock, I guess, the beauty of being human and allow people to focus on what it is that they want to do and feel some agency in life. So that's kind of how I got started. I first worked at a small nonprofit in New Haven, Connecticut, which was focused on literacy, kind of urban US issues. I quickly found that funding and partnerships were really the key leverage point in creating change. So even we were focused on the city and a couple of the towns surrounded, but quickly realized like, okay, if you can figure out how to get money and transfer resources from point A to point B, you can really shape the strategy of a program. You can see that people start doing things differently or they're able to do things differently once you move that money. And then partnerships, which I think includes funding, but is also a broader umbrella. You were just sharing with me about some of the stuff that the type 1 community is doing globally around aligning, right? And you think about partnerships as we're not all working in the silo. We have to figure out what are those connective tissue. So we're not in competition with each other, but we're also making our own ideas better. And we're kind of continuously having that quality improvement. We're saying, is what I'm doing really making a difference? And if so, great. How do we kind of expand that impact? And if we need to tweak or if we can do more by coordinating with another organization, we should figure out how to do that. I really loved that space. And a couple years after that, I moved to Partners in Health, which was a crash course in all things global health. I had no health background up until that point, but I was at Partners in Health for 12 years. So really got an honorary MPH in global health and through a very much a social justice lens, which resonated a lot with me. And during that time while I was at PIH, I also got an MBA from the Yale School of Management to want to expand my horizons and really complement this understanding of the world. So there are those who are really motivated around social justice issues and are kind of self-intrinsically motivated. There's also a lot of other things happening in the world, right? So many businesses, all this infrastructure, whether it's government, whether it's private sector. And so wanting to understand those dynamics on a higher level and again, be able to think about partnerships, think about financing in a more kind of sophisticated way. And I think the ability to analyze these markets and market dynamics really helps you then position for greater influence and more financing and greater impact. So what I'm working on now with NCDI Poverty Network and coming here, I became much more familiar with the issues in this space through my work at PIH. And I actually work with Dr. Bookman on Pen Plus, one of the first Pen Plus clinics in Rwanda, working with him on the financing and the positioning and thinking within the organization about what's eventually this pathway to scale for this. But I also was able to work on projects and with clinical leaders that were working on oncology and palliative care, mental health, and a number of leaders in the field. So that was a great kind of broad exposure to some of the health systems challenges and also the challenges that people living with these conditions in lower income countries are facing, as well as in the US. So really excited to be part of the Center for Integration Science and be working with NCDI Poverty Network on these issues because I think it hits on all of these social justice components that we're talking about. And I think ultimately it hits on how are we thinking about enabling people to live self-determined lives and have what they need to be able to focus on building their own careers, building their own families, building their own happiness in life. And that's really fulfilling. That's how I ended up where I am today.
I don't have words. Thank you so much, Rachel, for even diving deep into your background and experience, things that motivated you and why you're doing what you're doing, and especially sharing more about your journey into this world of nonprofit where you're working, trying to change, making impact, because mostly with everything that we do, working where we're working is about making impact, because we know that people, organizations, because of their own egos, will work in silos. And it seems like we're in competition, but we're trying to change. We are promising the people that we want to bring change, we want to help you to do this, to move from point A to point B. Even for you as organizations or as institutions, NGOs that are trying to help, I don't think you'd want to go for 20 years or even 50 years, seeing the same challenges, trying to help the same way, You'd also want even the governments to step up to try to use those very few resources, even if it's a $1 billion for one country, it's not enough. We are trying to manage with the resources we have. But for inspiring leaders in the global health, Rachel is going to share lessons learned from your career. Yes, you're going to share that. Also offer like some compelling call to action for all of us that are working to make a difference in the fight against severe NCDs, whether you are an advocate, healthcare professional, and simply a patient. If you're just passionate, I think, about the health equity, this episode promises to leave you informed and inspired. So thank you so much, Rachel, even for agreeing to be part of this call with extensive experience in mobilizing for all these high growth, mission driven organizations. I think maybe one thing we'd want to learn maybe from you is like, what are the key strategies you have found most effective in securing such donor?
Yeah, I think that's literally the $100 million question is how does one move that? And I love what you said a little earlier about, nobody at doing this work, you want to do the same thing year after year after year for 10, 20 years. You want to influence what other stakeholders are doing in the ecosystem. You really want to change the system, right? So you need to see that change. And so that's why advocacy is at the heart, I think, or should be at the heart of every nonprofit, which is otherwise it's just charity. But no, we're saying we want to work, we have a specific role to play in working with governments and working with the private sector and working with communities and families to really set a vision and to show a path to really bring people along. So I think this is really key. Your question around, I think this holds true for partnerships, for advocacy, but in particular for fundraising, right? It's all about relationships. I think that's the one thing where you can really kind of flip your head a little bit. It's not so much about asking for money, although you do need to get to the point where you make an ask, right? But the base of it is always relationships. And that's relationships that you are cultivating with institutions and individuals that do have resources to be able to fund or potentially fund the work that you're doing. This is also relationships with your stakeholders, for example, the people you're working with to serve or the communities you're working with to serve, relationships with your board of directors. So those that have influence over the strategy, the direction of what it is that you're doing. And it's relationships with your peers and with your fellow colleagues who are working on actually day to day, who are actually doing the work and are able to make decisions about and have that kind of on the ground. Like, this is easy for us. This is hard for us. This is what our organization is capable of doing. And this is what's harder for us, will take us a longer time. When we were talking earlier before we started the recording, and we were talking about your stakeholder mapping, fundraisers are in a really unique position to serve as a bridge in those relationships. So you're really bridging. I have a deep relationship with the folks that are doing the programs. I like the rocket ships. That's very cool. You have a relationship with folks that are doing the programs. You have this deep understanding of how people are working, what we're capable of, and what's the right length of time. What are the promises that I can make? And you can turn around and bridge and have conversations with those that have resources and really inspire them with the vision and also inspire them with, here's the road that we take to get there. And when you compare that, you compare a big picture with some really specific measurable steps of what it takes, and you know that your organization can deliver on it because you know what it takes to do those programs. That's when you really start building trust, you build excitement, and over time, it leads to that sustainability that you're talking about. There's two other points that I want to share here. I think one thing that I've seen when people are looking to fundraise, and you can fall into this trap, is it's not enough to demonstrate the need, because the need for any topic that you're talking about is going to be generally vast. And how does your need compare to another group's need? How do you interest somebody that might not already be passionate about your cause just through the need? And I think that you do have to talk about the need. You need to know how you're describing what the need is. Like, why are we doing what we're doing? Obviously, that's very important. It's not just kind of coming with your hand out saying, oh, there's so much need here, because that's not going to actually motivate anybody beyond a very kind of basic, I think, level of charity potentially. You really need to demonstrate that you have both a compelling need. There's a problem, a social kind of systemic problem that you're focused on in some very specific ways. And then that really is like, what's really exciting is when you can say, here's a need, and then here's a solution that we're working on. And here's a solution that we have good reason to believe is effective. And here's a solution that's impactful because of the other groups that we're working with and the people that we're working with and the networks that we have. It's important, it matters, and you can have impact. So you're sort of inviting people in to say, look, we can have this kind of change, and we can change systems, or we can change lives, and we have a credible kind of theory of change change of why that happened. We can point to things that we've done, and we can talk about why we want to do this next thing with you in partnership with your funding. And here's all of the impact it's going to have in the short term and then the long term. And the final piece here is this concept in negotiations where you find a zone of shared value, right? There's going to be an overlap in what you want and need, and then what your potential funder wants and needs. First, you have to understand the person that you're talking to. What do they want and need? And some of those things they'll say out loud, and some of those things you really will only pick up as you build a relationship with them. Some of those things you'll sort of infer, even if it's not said out loud. So you need to have a strong sense of what's in it for them. Like, what are they really passionate about? What do they want and need? That could be anything from their stated mission and they've made a public commitment to a certain thing that you can help them fill. It could be as simple as they're required by the IRS to distribute X number of dollars and they haven't done yet and they need to figure that out. They might be thinking what their next strategy might be. They might be thinking about that. And since you've been in conversations with them, you kind of have a sense of that, you can offer them, again, a solution. So when you find that and you're able to describe and say, like, here's how we can actually work together and meet both things that we both care about, you have a much stronger case. That works very well. And sometimes these conversations can take, 18 months. It could take 24 months, but you're working towards something quite ambitious that can be worthwhile.
Wow, that was $1 million question, but the response is sometimes people complain. We've been failing to secure funding. Think maybe if you miss some of the details, we know that this company or this organization does fund, but maybe they are not buying your story the way you're saying it. What's in it for them? It's not just about you helping people, because almost everybody wants to help. If they want to get funding, they want to unlock funding, people will say, we want to help. But how do you want to help people? What is going to be the impact? They will say that they want to do that, but you might not even get an understanding. Hence, some people or some organizations will not get the funding. Thank you so much for that interest, the passion that you have that goes beyond everything. I believe that people who are going to listen to this, they would be inspired. As we move forward, we are talking about sustainability, partnerships, talking about the concept of negotiation. What are your own interests, the interests of that of your partner? So you just need to understand from their own position, their own perspective. If you were the partner, will you buy the story? Would you want to do that? I don't know if you could share with us some of the critical elements that make a partnerships truly sustainable. I want to talk about those that you have already built partnerships with. How do you make it sustainable?
Again, I'm just going to say the word relationships, which is ultimately what it comes down to. I think one of the skills that I learned, particularly at Partners in Health, and have continued to hone and have been thinking about, in different ways and across different sectors when I went to business school, but I think it holds true, is it's not just having a positive relationship, but it's also what's your ability or what are your spaces and habits to facilitate continuous connection and dialogue with your partners. So making sure that your communications with them and the way that you think about your relationships is as something that you need to nurture and grow. You're investing in them. You're being deliberate about what you say and when you say it. You're being authentic. I think that's a huge part of it. You don't need to share every single detail of everything going on all the time. That's too much. But you do want to say, look, like if something's working, you want to share all those successes. If something's more challenging, some things happen, there's a political situation has shifted and it's challenging to deliver on that grant, you getting on the phone with your funding partner and saying, hey, this is happening right now. Here's kind of how we're thinking of dealing with it. We want to actually reallocate funds, et cetera. You'll find that funding partners are really, really responsive to that kind of authentic and timely communication about what's happening. I think this idea of kind of creating or thinking about your habits around continuous connection, to your point, it's not, I'm going to ask for this much money and then I won't talk to you for a year, and I'm going to ask for more money and then I don't talk to you for a year. That's very transactional. So you want to think about it in terms of partnership is really two-way street. And so you want to be feeding information, again, thinking of that area of like, what's in it for them, what's in it for us. Make sure that that zone of shared interest remains there. When it's time to think about the next phase of work together, you have a nice wide field to talk about possibilities because you've made sure that that stayed open. You made sure that they're understanding what it is that you're doing and thinking, and you're getting a sense of what they're doing and thinking in the field. I think the other component that I would name here is being able to take feedback from your partners. That doesn't mean that you always implement everything that is suggested, but being able to really engage, and I think this goes back to authenticity as well, and say, how are we doing? What are some ideas? Who else maybe should we be talking to? what should we maybe consider this question, that question of why did we choose to do it this way? Or why are we focusing so much on one aspect of the problem and not the other one? And there's no right or wrong answer for these, but really being thoughtful with your responses rather than kind of writing off what a partner has to say or what their feedback is can really go a long way again towards building that trust together. And honestly, it can make your own programs stronger. It can make your work stronger because you'll be learning from a different perspective. So all of that resource exchange, yes, the money, but also the knowledge and the information, etc. Every time you have a successful response back and forth, that's going to build that trust, and that trust is what makes the partnership sustainable.
I wish you could just stop the recording now, but we still need to unlock and talk about other avenues. Thank you, Rachel. This is amazing. And it's always great to learn from someone with experience, not someone with a bookish knowledge. If I want to get involved in these things, I don't want to get a funding because people know me, but I think it's better also. It's good. But also, I just want to do it because I've presented something compelling, something robust, something amazing, critical, not just because, hey, we know Tino, so can we just give him? I want to explore on where people don't know. My name has never been mentioned before. But if it's something, if it's good, then it should be supported. Whereas if it's about knowing who is doing it, who is behind the scenes, I don't think we are serving the purpose. So thank you so much for sharing about building relationships, taking feedback, and everything, like trying to build trust, because everything is about trust, right? Moving forward, the industry engagement from your career or the things that you've done, what roles should industries play in trying to improve not just diabetes care, but with the severe NCDs that you're working in, especially at NCDI Poverty Network? How can they be held accountable for their commitment? And I think that we have talked about this maybe before the recording. If you could share with us now for our audience to know and to learn also.
First of all, I really firmly believe that corporations have a responsibility to engage with these issues. Many of them are in various ways, but they have a responsibility. Corporations, in the US, they're kind of just their own entities, for example, but they have not just employees and shareholders, but they also have communities that they're based in, where their work and supply chain goes through. They have a lot of influence as an aggregate. They have a lot of expertise in some very, they are creating things that the world needs. We need them. That's why they're in existence. So they're very valuable, and they can accrue a lot of power, financial power and influence and expertise that we need. This is an integral part of the system. And I believe that they all have a role to play, and that role is actually going to look slightly different depending on the industry and depending on the leadership there. And I think there's a lot of strength in it being, in some ways, the private sector being decentralized the way that it is, because you do have some checks and balances there, and you have some peer pressure as well. But I also think that there's industry practices and norms and focus areas that can exacerbate, obviously, public health, that can exacerbate inequalities. And so we should be able to talk about those things with industry partners, frankly. And I think sometimes that dialogue is harder to come out in, more global forums. And it's hard to talk about it sometimes without it being seen as a anti-capitalist or anti-industry stance. I don't think that's true universally, but I think in some spaces that can be difficult to name or talk about. But being able to have those conversations with really influential industry leaders is really important. The accountability piece, one big part of that is government regulation. Government regulation will come from the people who are electing their governments ultimately. So I think that's a big part of advocacy, is thinking about, yes, we can advocate directly to industry groups. Let's be thoughtful about what's smart policy and what's smart regulation that's going to help balance the interests of everybody in this ecosystem, and maybe help make some hidden costs visible, and maybe have some of those costs borne by the industries themselves if it's right now all of those negative costs are hitting society as a whole. So that's one big piece. And then I think consumers and other stakeholders, pharmaceutical industries, and the patients that they serve, obviously they're connected in a really fundamental way, right? So there would be no market for what they produce if it were not for people that needed these drugs. And I think that's recognized in a lot of ways. And I've met some really wonderful people that work at various pharma companies on these issues of access, whether it's on the government and policy side or if it's on the foundation side. But I think the more relationships and dialogue we have with the people who are working in these positions and with the executive leadership of these industries, that's also where some of this accountability comes from on a very kind of individual basis, is having more insight into what are the downstream impacts and what are the ways that we might consider doing business differently to actually help mitigate some of those.
Thank you so much, Rachel, for this. I know this system usually works in the US, but doesn't maybe exist anywhere else. To know that the industry enjoy taxi breaks, it's a recommendation or something that organizations should do, that they need to have at least one or two NGOs that they give funding to. Yeah, it's a good thing that they enjoy these taxi breaks. But in other regions or countries, this doesn't exist. It's up to them to give you. But I know a bit, they always talk about corporate social responsibilities, which some do not even do implement anyway. So I think this is amazing. So thank you so much, because we know that like the industry, they are the ones, they control the markets, they control nations, they are the ones who influence even the policymakers, so that the policies that they will make would not negatively impact them, because they're the ones giving them the money, rather they're the ones putting them in power. So we, with our votes, we need really to be informed on the things that could affect us and everything like that. So thank you so much for sharing that with us. Moving forward, taking a bit of a shift into global advocacy, how do you see the role of this global advocacy evolving in the context of severe NCDs like diabetes, sickle cell? What are the most effective strategies for influencing policy at both national and international levels?
One of the things that I've observed so far, especially as we've, as a community, a global community, have started talking about the road to the high level meeting in 2025 on NCDs, has been, where's the action? How are we with global commitments? How are we creating frameworks that is spurring action in a global sense? And financing is part of that. Financing mechanisms that are really incentivizing and resourcing the multitude of actions on multiple fronts to address the burden of NCDs, and then specifically for severe and chronic NCDs, what does that look like, particularly within the health system? And that feels like the direction that global NCD advocacy really does need to evolve, is thinking about how are we framing these issues, maybe not within a really broad umbrella of NCDs that includes everything from obesity and hypertension among older populations, also children living with type 1. That's such a broad umbrella, and the needs of those populations are so distinct, but they're all under the NCD agenda right now within the global dialogue. And this is kind of where they live. And you can see from a country point of view, if you were running a health system, you kind of take that and say, well, where do I start? How am I going to be measured on this? There's almost so much to do that if you're given a list of 1,000 things to do, you're almost at some point, look, I know I'm never going to do all of this in the next 5 years. So how motivating is that? Right? So one of the things that I really find compelling about the Pen Plus model and about the work the NCDI Poverty Network is doing, and a number of our partners in this space, partners working with type 1, partners working on rheumatic and congenital heart disease, partners working with sickle cell, is that we're creating a community that is a little bit more distinct than NCDs. And it's also tied around a really actionable package, which is Pen Plus, which is actually pulling together the accurate diagnosis and then care, long-term care for people living with these conditions, and its life's not capped off at a certain age. And so thinking about it again from much more of a person-centered and a health system-centered point of view, it's very actionable and it can be costed. It's something to understand, and it's something that there's supports around it to help governments and different health systems understand how to integrate these types of services as well. Would love to see more integration of different packages of care and packages of action, because if it's not, maybe we're talking about public health interventions that aren't taking place at a health facility, so it's outside of the health sector. But even that, right, they need packages of actionable care that are not just single disease or issue focused, but aren't every disease and issue focused. I see the NCD community more broadly is starting to coalesce around some of these in different ways. And it'll be really interesting to kind of see how NCDI Poverty Network can engage with different groups to think about, again, some of this integration. And then similarly, I think for type 1, which has an incredibly sophisticated, network and advocacy framework and platform, as well as these other conditions, how can we do more? How can we think about action as we begin to work where it makes sense in an integrated way when we're looking at it from a country level standpoint and when we're looking at it from a global standpoint?
This is amazing. It's commendable. We always need to work together to always come up together and create the change that this would mean. This will create some motivation to people that wants to continue to address these issues. So now we're talking about future directions on the things that we should be looking out for. How do you envision the future of global health partnerships, from the understanding on public health, the health inequalities, of the things that you're addressing, things that you've worked on, particularly in the context of the chronic diseases like severe NCDs?
I think it goes back to what I just said around integration and finding those areas of commonality. Historically, if we've talked in either very specific disease specific way or a total NCD way, those frameworks have kept us, collective us, from maybe having some of the conversations across disease areas to identify where are those areas of shared interest, actually, of the actions that we could take to improve all of our outcomes. And so I do see increasingly there's a drive towards how do we create mechanisms and invest in the right level of communication across different organizations. And, you're seeing this right now, again, within the type 1 community. How are we talking to each other, and how are we mapping out what the needs are and prioritizing those, and how are we complementing each other's work, and having that space for that conversation, that multilateral conversation is really, really important. And I see that funders, implementers, NGOs, community-based organizations are all increasingly getting there. Of course, there's a cost to doing this, which is why, it hasn't necessarily the natural way of doing things, right? But a sort of overall orientation and recognition, particularly post-COVID, I think, has everybody waking up to this sense that, the way that we've been framing this maybe hasn't been leading to action as much as we want. And how do we create more actionable power blocks so that we're standing and able to, again, influence those stakeholders and the system as a whole to unlock some of these changes that we need to see. Can I also just make a note on the empowerment and community engagement piece? I realize there's one piece that I would love to, shout out, I guess, to you guys and the work that you're doing, but also make a plug for, which is empowering local communities. I mean, I think everybody has their own power inside of them in different ways. And yet I feel like oftentimes it's possible to go for a long time without recognizing your own power, or without recognizing how to cultivate it, and maybe without getting the respect that you deserve, right? In different spaces in different ways. The capacity building work, which to me is like, I am a true believer, like everybody should get an MBA, right? Like it's the most transformative piece is being able to see yourself as a leader and understand yourself as a leader. And there's many different types of leaders, but getting to a point where you can really advocate for yourself, that takes capacity building, that takes a community, that takes a lot of reinforcement from a lot of different places. And so if we want to think about even the future of global health partnerships and how they evolve, and breaking out a little bit from nothing for us without us, breaking into that more authentically, part of that to me is really taking a look at decision-making mechanisms in different spaces, taking a look at where decisions are made, how money is allocated, thinking through how do we make those decisions, who's at the table, and also what are the capacities that we need at the table, and how do we make sure that people living with these conditions have those capacities, have the bandwidth to be able to be engaged in this way. Those kinds of very long-term pieces. And again, I feel like there are many groups that are already talking about this and doing a lot of really interesting work in being able to realize that. But it's really been a change from, okay, let's just have somebody say a few words at a conference. Okay, and now everybody else is going to talk. Individuals' opinion is not asked later. So those components, I think, are fundamental to that community engagement, and that capacity building is fundamental to the future of global health partnerships.
Thank you so much, Rachel. On the lessons learned that we probably couldn't unlock, what are some of the most important lessons that you feel are important that they should know that we didn't ask you about? If you could share with that.
All right. I like this question a lot. And when I was thinking about how to answer it, I thought over my own journey and what I felt I most needed to hear probably a decade ago. One of the biggest lessons I've learned in this has been that you never sacrifice yourself for a cause, and you have to learn how to nurture yourself. When we talk about sustainability and we talk about impact and we talk about need and change and the world that we're working towards, the irony is that a lot of people in this space, in the social sector space, in the NGO space, community-based organizations, you are carrying psychologically some really, really big thorny issues, and you're taking responsibility for them on some level. You're choosing to pick up that burden, and that's commendable. But why work towards a better world for everybody else while hollowing out yourself? I think just naming that it takes a lot of people contributing what they can, and that others will step up when you need to rest, and having that faith in humanity, I think, is so huge. I guess that's also one of the most freeing pieces, which is that when you do need to take a rest, or you do need to care for yourself or your family or do something just because you want to do it. There will be others who will step in. The system will keep going. And when it's time, when you're called to lead, when it's time for you to step up again, the universe will tell you and you will know. There's never a point in time where you should be burdened by guilt about not doing more.
Wow. Thank you, Rachel, for this. This is amazing. It's Christ story. I relate so much with what you just said. Not that I have experience, but I think on what I've just learned over the few years that I got involved in advocacy work, I've always said this to people, and people be like, okay, Tina, do you feel like someone could take your spotlight? I'll be like, no, I think I'm so grateful that I get to be part of these things. And I believe in a way, all these things could still go on even without my involvement in it. But I'm so humbled and so grateful to be part of this, everything that is going on. It's one to hear that so many things are happening in your country. If you're now part of the change makers, it's another thing. It's amazing. It's big. I think it's about learning from each other, trying to bring out the change that this world needs. Even if I wasn't to be doing this, I believe this week could still go on. And it will continue to go on because this is big, bigger than us, bigger than all of us. Not about a legacy. No, it's just a way. I don't know where that it came from, and whoever talks about that, it's not about legacy, but it's just living the moment and trying to do the things that you can with the resources that you have access. I think that's what keeps me moving. So thank you so much, Rachel. $1 million question to you in closing, like a call to action. Like, what message would you like to send to the listeners?
I think it's very simple. Investing in your relationships are the most important thing you can do to influence other people and to get feedback, to make your work effective and responsive. Also create a community that's going to support you. Prioritize that, and I think a lot of good will come.
Thank you so much, Rachel, for sharing your incredible insights. Thank you so much for being with us today from Effective Donor Strategies, Empowering Grassroots Advocacy. Thank you so much for your leadership in the global health. To our listeners, let's take Rachel's message forward by fostering stronger partnerships and also driving action. So this is what I believe. As like you say, thank you so much for your authenticity. Stay tuned for more impactful conversations on Global Diabetes Insights.
I just want to say thank you, and I am so honored, and I have already learned so much from you. It's incredible to witness the leadership that you are taking on the continent through Voices and through all of your other partnerships. Forward to continuing the conversation.
Thank you, Rachel. That means a lot to us and to our listeners, to everybody, to me.